Well, for more than a year, we've been stuck at home during the pandemic, and for many people, they found themselves killing that time in the kitchen and putting on some unwanted pounds. So when does weight gain become a problem, and how can you get help? Well, joining us right now is Dr. Jon Pirrello, medical director, for Metabolic and Bariatric Surgery at Hartford HealthCare. Jon, thank you for joining us.
Thanks so much, Amaya. Thanks for having me.
Now, question for you. How are people struggling with obesity at risk when it comes to COVID?
So patients with obesity in general, one of the bigger challenges that they're facing is it's a chronic inflammatory disease. And when patients have had obesity for a long time, they often develop other medical problems that are also increased risk for having bad outcomes with coronavirus. Problems such as hypertension, diabetes, coronary artery disease. In addition to that, the way that COVID is most deadly is it reduces the body's ability, the heart's ability to get oxygen to all the tissues. So patients who have obesity are often, their heart and lungs have increased difficulty, having to do additional work in order to get oxygen and blood circulating throughout the body. So they're already kind of starting off with less reserve. New study just came out from the CDC actually last month that shows that a direct relationship as BMI increases. There's a direct relationship with increasing rates of hospitalization, ICU admission, mechanical ventilation, and death across all age groups.
Wow, and so many people have gained weight during the pandemic. How do we know when it's time to get help?
So most of the studies suggest that the average weight gain during the coronavirus pandemic has been about 10 to 25 pounds per person. So the initial things we want to focus on, people want to focus on healthy eating habits. A big part of healthy eating is delaying long periods of time with no intake at all. A lot of people when they're dieting actually put too much emphasis on not eating. So we want to have healthy eating habits. We want to have better physical activity, better sleep habits, and then stress management for certain. And if people aren't sure whether or not it's time that's working for you, that's a good place to start, as always, with their primary care doctor.
And any advice for folks? And also, doctor, there's a bill in the legislature that relates to the treatment of obesity. Anything you want to share with us about that? So when patients, the best thing they can do is to follow the recommendations by the CDC. Certainly, if patients are eligible, get the vaccine. It's been very, very successful at reducing severity of disease and preventing disease. One of the biggest barriers we're seeing for patients is whether or not their insurance is going to provide benefits for access to treatment for obesity. So the State Bill 1007 is currently in legislation, and it's increasing, or it's a bill to require insurance companies to provide access for patients to the most effective means of treating obesity, which are medical management and surgical intervention. Dr. Jon Pirrello, quickly, any last thoughts for folks struggling with this issue?
I mean, it's been a big challenge the last year. It's been hard for a lot of people in a lot of ways. One of the worst things you can do when you're trying to shake out of a depression or a funk or a situation like this is to do nothing. So if anything else, as the sunshine gets better, get out of the house, get together in a safe, responsible way with people that you know and love, and, just put the badness behind us.
We can try to do that as best we can, right? Thank you, Dr. Jon Pirrello, for joining us.
Thank you so much, Amaya.